The do's and don'ts before entering. These are some things that we often don't think about, although after mentioning them, they're probably common sense. Flowers may or may not be appropriate. You ought to find out with the nurses beforehand. Some people are not allowed to have flowers in their room, especially if they're going through times where they are vulnerable or susceptible to diseases. So flowers may not be the most appropriate gift. You want to confirm the location of a patient at the front desk, because just because someone told you they're in room 220 doesn't mean they haven't moved. And why waste time or walk in on another patient when you could just simply ask at the front desk and confirm what room they're in, or perhaps still in. Always knock before entering, and look at any signs that are posted on the doors, because they're going to give you some instruction too. Always follow those instructions. But knock before entering. Who knows, the person might be in the middle of receiving some kind of a treatment or being helped to the bathroom, or might be at a point where they're in the middle of a conversation with someone that they need a few extra minutes. Go behind curtains only with permission. So maybe the door was open to the room, but the curtain around the bed is closed. It's good to ask, is it okay to come in? Before you actually open that curtain. Someone behind the curtain will likely let you know. If you don't hear anything, then go to the nurse's desk and say, hey, the curtain's closed. I'd like you to check it out before I go in there to make sure it's okay. Perhaps that person is sleeping and does not want to be disturbed at the moment. The nurse will tell you that. There's only very few occasions when you should wake a patient, and those few occasions ought to be determined by the nurse or medical staff. Some more do's and don'ts while in the room. Look around the room for some things that might give you some clues. What is the person you're visiting doing? What is his expression when he sees you? What seems to be on his spirit? Is he up or is he down? Does he have get well cards? In other words, are people writing to him? Are people concerned? And what might he be experiencing? Are they displayed or are they stacked? And what might that mean? Does he have flowers? Does he look as if he has been sleeping and you're kind of interrupting? Do you see a newspaper that he appears to have been reading? Is he watching television? Perhaps he seems to be doing nothing, but everybody is doing something. So, we already talked about this. Make yourself shock-proof. The person may look poorly. Any sign of distress that he sees in your face will be magnified in his mind. This is the power of suggestion. If people tell you you look ill, you will feel ill as well. You don't want to tell them that they look good if they don't, but you don't even have to bring any attention to it. Acknowledge the patient's other guests if they're there. That's always important to do. For whatever reason, we're uncomfortable, we're just not thinking, and we are going there to meet that patient, and we don't know the other people in the room. Say, hi, how's everybody doing today? I'm so-and-so. Or something even simpler, but just by saying, hello, everyone. But just don't pretend that they're not there, because they are. And that makes it awkward for everyone if you don't acknowledge that other people are in the room. Let the patient take the lead in shaking hands or initiating any touch. They may have an injury, or they may be susceptible to illness. In fact, when I'm visiting someone, I really try not to do too much touching, or I ask how they're doing, or if it's okay to give a hug. Let the person take the lead in speaking after you say hello. In other words, give a moment for them to say what might be on their mind or what they want to talk about. Leave the burden of silence on them as well. If they feel like talking, they will begin with something that's on their minds, and that's the best place to start. Probably something that's important to them. If your patient says nothing, the silence may tell you that he or she doesn't really feel like talking, and that's important too. Sometimes we just need to also let people know, hey, I'm going to be present for a little while, and if you just want to rest, that's okay. Don't ask how the person feels, because they're in the hospital, and there's nothing they can do about it, and they probably don't feel too good, so it's kind of a dumb question anyway. To the person who is ill, this really is a medical question. You're not a doctor, and you're not there to take care of the physical concerns. You are there to minister to spiritual and emotional needs. If your patient wants you to know how they feel, let them share it without your inquiry. Don't ask the person what's wrong with them. This is another medical question. Some things may be more personal than the person wants to share. I gave an example of that earlier. How you may be taken as being too nosy. And use your silence to show you care. Just being present oftentimes is enough. Alright, a little bit about your physical presence in the room. Don't force a patient to move. Stand or sit in the patient's line of sight. And don't force them to strain to see you. Sit down and relax. Standing tells the person you're in a rush. The only time you stand is when there's other folks in the room that might need the seat more than you. Also, never sit on the bed, even if it's empty. This is the only personal space this patient has at this point in their life. And, not to mention, the bed may need to be sterile. And who knows what you've picked up on your clothes or on your hands since you've come in. In fact, make sure you always sterilize your hands upon entering the room. Let's talk a little bit about your mood and appropriate emotions. It's good to be cheerful, but don't overdo it. You don't need to clown around or be the life of the party, unless that's just the normal way you are. And tears aren't always bad. It's okay to let the person know that this is really affecting you too, and that you really care deeply for them. And don't give false optimism. You certainly let people know that you're praying for the very best outcomes, but don't let people tell people that, well, they're going to be healed no matter what, and this is just pray for the very best. And allow the doctors to determine what course of action, while also reminding the person, when you feel appropriate, that God ultimately is the great physician. Let's trust yourself to His care as well. Refuse to be offended or insulted. Alright, folks that are in the hospital and they're sick, they're not at their best, as far as they might be a little more irritable than at other times. Family members might be more irritable as well. Give a lot of grace. Refuse to be offended or insulted. They may say things that you don't necessarily like. They may respond in ways that make you feel like you aren't necessarily wanted. Pick up on that and just say, hey, I really care about you. Make the visit a little shorter, because maybe they're just having a hard time and they've had too many visits that day and they don't really know how to say that to you in another way. But remember, they're at a difficult point in their life, and they might say something, or you might say something that they take the wrong way, and they may respond a little snippety, or that's okay. Remember, you're there for them. It's not about you. Don't be alarmed by mental or spiritual dullness, medications, situations, circumstances. That's okay. Allow them to go through this time in the way that their body and their mind is going through it, while also encouraging them, but not trying to force them into a different way of being or thinking. Don't do anything to help physically without permission. The person might be uncomfortable and you might want to help them to adjust. Really, the best thing to do is to say, hey, can I go get a nurse to help you with this? Or the person might need to use the bathroom. Oftentimes on the door it'll actually say this person needs assistance from the nursing staff for the bathroom. Don't take anything on yourself that you don't really know what you're getting yourself into. There is medical care to provide all the physical care. So medical assistance is. So feel free to go ahead and if something's going on, you can be an advocate for that person by letting the nurse know that something needs to be done. Speak just loudly enough to be heard. So just be careful for your voices, and oftentimes they might have other people in the room as well, other patients that they're sharing a room with. So you want to speak loudly enough to be heard so they don't have to strain to hear you. But remember, you want to keep your voice at a outdoor or an indoor level. Always respect the patient's privacy and dignity. That means when nursing staff comes in to do something, you can always say, can I step out for a moment? Because the person might not feel comfortable in doing this or asking you to do that. So always take the initiative when they're receiving care to be able to step out, and the nurse or the assistant will let you know when it's okay to come back in. Now, Getting spiritual. Try to sense whether the person wants to talk about spiritual issues or not. Oftentimes we want to keep things pretty superficial, but remember you are there as someone who is coming to care spiritually and emotionally. This is your main role. Let the discussion flow however the person wants it to. But I always found that people seem to appreciate that somewhere in the conversation I ask, how are you dealing with this spiritually? How are things going with you on the inside? Of course, remember, if there's a lot of other people in the room, it may not be the time to get into serious spiritual discussion because they're probably not comfortable talking about this with other folks in the room. So use your discernment on this. The person oftentimes will be relieved to be able to talk about those things, what they're wrestling with, or if they're doing well and they want to share that with you. Sometimes I ask, how do you deal with this? How do you stay connected with God through times like this? Spiritual practices are good. You can offer a devotional or something that can be an assistance in this. Or they may show you that they've already got something that they're enjoying and that they're using. Or at this time, they might also say, well, I really just can't really connect because I just don't feel very good. I can't read right now. You can assure them that you're praying for them. Use Scripture with discretion and according to the person's need. In other words, choose passages that hopefully you've prayed about and that promote healing of the soul. The person might be frightened, so you use passages that speak to fears. It's often good to get a list of passages for different circumstances or situations. I have some of these lists myself, and I'd be glad to share them with you. And then you can kind of go to that section on what this person might be dealing with that might help this person, one of those passages that might be applicable. Person might be lonely, so choose passage that reminds you of God's presence. Like I said, if you've got something in the back of your Bible, and as you're talking you get a sense that what this person is dealing with, you can go to that back of the Bible where you've written these things for passages that deal specifically with certain emotions or situations, and be able to use those passages with that person at that time. Here's some things that you shouldn't say. Keep your diagnostic opinions to yourself. Remember, you are not a doctor, and don't analyze what the doctor is or isn't doing. A lot of times the person will tell you what kind of care they're receiving or what they have problems with the doctor. Listen, empathize, but don't offer your opinion on the doctor or the nursing staff or their care. Just say things like, I can see why that would be difficult, or that must be frustrating, or respond in a way that lets them know that they're heard. But we don't really need to add your opinion to what's going on, because honestly, you don't really know what is going on. If you really do have a concern, you might want to take that to the medical staff if you feel like that's appropriate, or to family members, which might be more appropriate, and say, hey, she or he mentioned this, and I just wanted to make sure that you knew that this was one of their concerns. Don't know if you already know about this or not, or if you want to take it further to medical staff or to supervisors. Keep your horror stories to yourself. This is not the time to share stories about how things went horribly wrong in a situation similar to this person. Sometimes you don't even realize you're about to do this. You just know that their situation reminds you of something. Not everything their situation reminds you of should be shared. Keep your troubles to yourself. You're not going there, and they're going to ask you how you're doing. But you're not going there to be cared for by the person. You're going there to care for them. So keep your troubles to a minimum. Say, sometimes things are tough, but I'm doing okay. God's taking care of things. How are you doing? That's what I'm really concerned about. I'm sitting in the chair, you're laying in the bed. And beware of criticism. I know we talked about this just a minute ago on medical care, but also when it comes to food or any other kind of service. You can listen, but don't join in. Don't repeat these complaints to people who don't need to know, such as administrators or perhaps family. Those might be the appropriate people to talk to, but use your discernment to figure it out. You'll only support the patient's dissatisfaction if you key in on all the times that you received bad care too. And you may actually delay the progress of their recovery, because remember, our emotional state of mind and how we feel what's going on around us certainly does contribute to our healing as well. Finally, ending your visit. Remember, hospital visits really ought to be brief. 10 or 15 minutes is usually the appropriate amount of time for a hospital visit, unless you sense that this person really would like you to stay longer. Only stay if this patient is carrying the conversation. and a topic that's important to him or her. You don't want to cut them off while they're sharing with you and they're engaged in conversation. Promise a return visit only if you're sure you're going to be able to. Pray for your patient. It's always great to be able to end the visit with saying, hey, it was great visiting with you. Do you mind if I pray with you or for you before we end this? You could say something like, would you like me to pray with you now? Or would you prefer that I remember you later in my own private prayers? The person you're visiting may be uncomfortable praying with another person. Maybe that's not a habit they're used to, or maybe they're just not in the mood for it right now, and this at least leaves both options available to them. Take the patient's concerns into account. Oftentimes I ask, I know I want to pray for this situation that you're going through, but there's anything that I can pray for you specifically that's on your heart or your mind? They'll often be very grateful. Don't think that you know exactly what's on this person's heart or mind. This will give them an opportunity to share with you what they really could use prayer for. Sometimes it'll not only be for themselves, but for how other family members are dealing with the situation. Make sure you keep the patient informed of what's going on, informed of what when you're going to be back. Maybe informed on issues that are going to be relevant to them, about what's going on outside. But remember, don't allow these things to dominate. Just keep them up to date on things that you think are important to them. And also help with small errands. I found it's good to ask a person as they're stuck in a hospital bed, hey, is there anything I can pick up for you? What kind of magazines do you like? I've gone and picked up magazines for folks, or some people ask me for lip balm. So I've gone and picked that up for them. Little errands, things that they can't get around to, that they might appreciate, and they might sense that you would appreciate being able to help them in this way. And the gifts that you bring, make them practical. Really, flowers aren't always the best gift. For one, they might not be able to have them in their room, or they already have too many. So try to do things that they might bring, things that they might enjoy, or they might actually be able to use. Devotionals are always a good one. A Bible. Have they got a Bible on hand? Are they able to read that Bible? So things that are going to be practical for them. Finally, we're going to talk about a different kind of visit. And most of these things that we've already talked about apply, but remember, some things are a little different. People that are shut in. These might be people that are long-term in a nursing home. And when I say long-term, I mean a few weeks or more. Or people that are at home and can't really get out. These people don't tend to get as many visitors because they've been where they're at for quite some time. And people over time stop visiting quite as often. They can be overlooked and forgotten by the church as well. Make sure you call and make an appointment, because a lot of times these people do have some sort of a life. They've got things going on where they're at. Activities, dinner, lunch, breakfast, all of those things. So call and find out what time would be best. About a half an hour time if you're visiting with someone that is in a nursing home or shut in. And consider taking communion to them, because they may not have had communion for quite a while. There's actually another training to train you on how to take communion for visiting those that are shut in. And eat with your patient if you're invited. Oftentimes at rest homes or recovery places, they can invite people to have a meal with them. So go ahead and eat. They might really appreciate being able to share a meal with a friend again. Well, that is the end of this training. So just a couple of things to remember. Always knock before entering. Try to give a call if you can before coming, especially for those that are in nursing homes or shut in and might have other things going on. And make sure that you listen, and be an encouragement. Find out what your patient needs emotionally and spiritually. You're not a medical expert, so don't give them medical advice. And even if you are a medical expert, that's probably not what you're there for as a deacon or a deaconess. Do a great job, have a lot of fun, prepare and learn from your visit what you can do even better next time. Great. Thanks a lot. Thanks for joining us in this training.